The following film is not intended to encourage parents to interfere with their child's Pavlik harness. The received advice is that a Pavlik harness must only be applied or removed by a specialist. The purpose of this film is to assist in the training of healthcare professionals and to familiarise and reassure parents whose children are affected by hip dysplasia. Hip dysplasia is a condition that is often treatable, and most children treated have no long-term problems. The definition of the condition is when the ball and socket of one or both hips does not fit snugly together. The severity of the condition varies from the hip joint being underdeveloped, to the ball being somewhat loose in the socket, to having the ball fully dislocated from the socket. How long a baby will have to wear a Pavlik harness depends upon how severe the hip dysplasia may be. Usually the wear time will be between 6 to 12 weeks, and sometimes a little longer. The harness is normally worn for 24 hours a day, every day. A Pavlik harness is composed of a light and soft fabric and has a chest strap, 2 shoulder straps and 4 leg straps. If your harness looks slightly different from the one shown, please don't worry. Harnesses do vary. This is Isabella. Isabella has hip dysplasia. This video shows the correct application of the harness. The harness is opened and laid flat. The baby is placed on top of the harness. The chest band is fastened across the nipple line, just below the shoulders. Next, the shoulder straps are fastened so that 2 to 4 fingers width can be placed between the chest band and the baby's armpit. This is for their comfort. Then the baby's legs are placed into the booties on each side. The front leg straps are adjusted to allow 90 degrees of hip flexion. The back leg straps are fastened so that they cannot be brought completely together in the middle. The positioning of your baby in the harness is in an open frog position. The shoulder and the leg straps will be marked or taped to denote the position they need to be in. Note that clothing worn should not constrain the baby's legs or make it difficult to access nappies. If using trousers, they need to be extra large, or if a baby grow, it will need to be one size up. To remove the harness, undo the chest strap. Then each shoulder, then undo the leg straps at the lower leg and foot. Do not remove the Pavlik harness to change a nappy. Instead, lift up the baby's bottom by placing your hand underneath it so you can remove the nappy. Do not use the child's legs to pull up. If the nappy is dirty, you may want to cover the legs with a sock to keep the harness straps clean. In addition, a vest can be worn underneath the harness. When taking the vest off, lie the baby down and loosen the chest band. Then, undo one of the shoulder straps and take the baby's arm out of the vest. Take the vest over the baby's head and refasten the first strap. Undo the second strap and then take the left arm out of the vest. remove the vest and then refasten the second shoulder strap. Keep the skin clean and dry. Talcum powder is not recommended as it can clog. Breastfeeding can be achieved in the regular position, as can winding. Parents wishing to swaddle their baby must be careful to do so in the correct way, allowing enough room for their legs to move freely. The baby's hips should remain up and out in a frog position. For further information about hip dysplasia and care, please see the Developmental Dysplasia Pavlik Harness Information Book, the STEPS and International Hip Dysplasia websites.
There are no known causes of hip dysplasia, but we know it's more common in firstborn girls, and we know the risk factors are breech presentation and family medical history. The length of time that your child will be in the harness is a minimum of 6 weeks, and that's full-time wear, 24 hours a day. In our centre, we would then wean the child out of the harness. So for example, at week 7, they have an hour out, and that's when they can have their first bath. The time that they're allowed out of the harness is gradually built up. And then by about week 10, they're going to wear the harness for nighttime only, for a minimum of 12 hours at nighttime. So some centres will vary, and that's absolutely fine. The success rate of the harness is reported in the literature as 95%, but that is dependent on the age that your child is diagnosed with hip dysplasia. Ideally, we would like to have them diagnosed before the age of 6 weeks. In the few cases where the harness isn't successful, your child will need to have surgery. And that might be in the form of a closed reduction or an open hip reduction. It's uncommon for your child to have any adverse reaction to the harness. If there's any signs of rubbing and you're concerned, then talk to your health professional for some pointers in terms of treating that. There is a risk of femoral nerve palsy, which is quite minor, but you need to know about it. If your child stops kicking their legs, then you need to tell the health professional, and the harness needs to be removed until the nerve has recovered. It just means that the nerve has gone to sleep temporarily. When your child has been placed on a Pavlik harness, they need to be followed up quite closely in the clinic. And in most centres, this is being seen 1 to 2 weekly. The harness is checked to make sure everything is okay in terms of fit, but they should also have an ultrasound scan to check the position of the hip, and then you can be informed that the harness is working and all is good. Your child will be measured for the Pavlik harness, so the appropriate size is fitted, and they come in a small, medium, large, extra large. Occasionally we've had to use an extra small harness for a baby. They will be checked every time they come to clinic, and if your child has grown out of the harness, the next size will be applied. To transport your child in a car seat, then that's absolutely fine. You can put them in as normal. It's not ideal to do long journeys, and if you need to do one, then you need to take your child out for a short period of 15 to 20 minutes, and ideally place them on their back so their legs can be splayed out in a frog position, and then put them back in the car seat again. There is no ideal car seat that is suitable because they all tend to bring the legs together slightly, but you do have to get from A to B, and we understand that. You can place your child in a stroller or a buggy as normal. If they're in it for a long time, that's not a good idea, because ideally we want their legs to be splayed out in a frog position. The best position for your child's healthy hip development is with the knees bent, the hips flexed up and the legs splayed out. Any equipment that compromises this position is not really recommended. And if you're in doubt, please contact your health professional and they'll be able to advise you. Your baby will be in the harness full time, so you won't be able to bath them, but you will be able to keep them clean using a cloth, some room temperature water and some mild baby soap. When your child's hip treatment in the harness has finished, it's usual for them to be followed up in the clinic. The length of time they are followed up varies between centres.